Great. Thank you guys so much again. It's a real pleasure to be here. And, of course, I forgot to thank our CMI and Dr. Emma Fernandez-Repolla for this amazing opportunity. I often think of kind of these symposiums as exactly what Urian was saying, opportunities for mutual learning, of a place for us to share our work and also very much get feedback. So it's a real pleasure to be here today. Similar to the projects that Urian presented, I too will be presenting one where we're tackling kind of what I think is one of the largest public health issues here in our country, thinking about gun violence and its impacts on the community, in a community that is also based now, what is our home, and I hesitate even saying that, in New Haven, Connecticut, which has an incredible town gown, deep mistrust of university researchers, given its long-standing 300-plus year history with Yale University. And so it is in that space that we really started tackling this issue of how to think about dealing with gun violence and using the framework of community resilience to mitigate gun violence. Perfect. So I'm going to spend 30 minutes or so really talking a little bit about the background and theory of our work, then move into the methods, results, talk about the limitations and some brief conclusions based on our pilot work, and then explore interventions and next steps. So here's a map of New Haven, and like many cities in the United States, including, not including, but as well as in San Juan, for instance, New Haven is really struggling with gun violence. Between 2000 and 2010, New Haven has seen a tripling of the homicide rate, for instance. And here's a map of New Haven. It's kind of kangaroo-shaped. What you can see is that so in the greater New Haven area, the violent crime rate is about 4 per 1,000 residents, but there are specific 6 neighborhoods that have the disproportionate share of violent crimes. And in those neighborhoods, the rates can be as high as 30 residents have an experience of violent crime per 1,000 residents. I don't think it'll come as any surprise to anyone in the room that in these specific communities there are higher numbers of minority residents as well as individuals living below the federal poverty line. This has been a serious issue in New Haven for the last decade, and then again 2 decades past. And throughout these decades there have been significant number of government as well as police-driven interventions, and you can imagine them, that are really focused primarily on the victims and perpetrators of crime, but none, not a single one has been community-driven, not a single one has lasted, and not a single one has really directly focused on the community response, the community experience. So what happens to the community members as they live in an environment of chronic, persistent gun violence? And so it is in this vein that in 2012, so about 4 years, rather 2011, 4 years ago, we convened the New Haven Community Health Violence Prevention Group. And what you can see here is that our violence prevention group started with neighborhood residents. It included neighborhood youth. It included the city of New Haven, important government stakeholders, including law enforcement, the judicial system, the housing system, the public school system, as well as university partners from Yale and the healthcare system. And it was in these conversations that we realized that in our community, like others, many people would convene around a natural disaster. But no one came out, not anyone, in response to gun violence, which our community saw as a chronic man-made disaster. In one of these first conversations, there had been a shooting in a public housing development. A community organizer that I knew very well, who had a past history of incarceration, that works with us on many projects, finally spoke up, and what she said really resonated with the group. And I quote, "It took so much for me not to break down crying. I know firsthand what it feels like to live in this war zone. It affects me psychologically, emotionally, mentally, physically, and socially. I do so much work in the community, but when I go home, my outreach efforts stop. I hide in our apartment, don't engage with my neighbors at all. I'm traumatized and know how much I needed for someone to go door to door just to see if families and children were okay and needed to talk. And this kind of catapulted many other responses in the room. Again, this is a woman who's a community organizer. She is out there doing the work, trying to really engage individuals that are returning home from prison. And she felt incredibly isolated, scared, fearful after having lived so many decades in this public housing development where neighbors that she'd seen, family members that she'd seen had actually been shot and killed. Others spoke up. And it was around this issue of thinking about how the fabric of community has really been broken down that really gained more interest, catapulted kind of a more collective vision of how we might respond to and prevent gun violence. So our group as a whole, again, this very diverse multi-sector group, really settled on this issue of community resilience. It's a hot conversation, hot topic now. I know that San Juan was just named one of the resilient cities as deemed by the Rockefeller Foundation, but this is the definition of community resilience that resonated with us. So it's the ability of a community to band together and use resources to respond to, withstand, recover from, and even grow from bad events. In the natural disaster literature, again, we turn to this framework that can guide communities to prepare themselves in the face of recurring disaster. This is a framework that was first developed by the Rand Institute and has now subsequently is being used by Obama's Federal Emergency Preparedness Agency in thinking about how communities, again, can build resilience and respond to natural disasters. And this spoke to our community members in particular of thinking about a framework that could be used and leveraged to think about responding to this chronic man-made disaster, gun violence. In this framework, what you can see is what you have to utilize are these 8 levers to then move to the core components in order to build community resilience to respond to gun violence. And so we chose to focus on the levers of engagement and self-sufficiency in order to build social connectedness and thus build community resilience. After this is 2 years long of conversation of thinking about these sorts, what sorts of interventions would be most meaningful in this community, we convened then a smaller group, the Community Resilience Steering Committee, that included, again, neighborhood leadership, residents, as well as some local nonprofit leaders, and then Yale University physician researchers. And then this small group was tasked to oversee both the community resilience building efforts as well as our research endeavor. So I'll move now into our methods. So acknowledging that we are focused on the levers of engagement and self-sufficiency to build the core component of social connectedness, we examined related concepts in the literature of social cohesion and collective efficacy. Social cohesion are kind of the ties that bond together community members, and collective efficacy is the ability of community members then to leverage those ties to act on their own behalves for social change. The first question that we wanted to address was whether social cohesion and collective efficacy are even associated with exposure to gun violence in high-violence areas in New Haven. This is a question that hasn't been explored in the literature, and this was really what was driving our community members. They really felt like, again, the breakdown of these social ties, what was really driving kind of to increase exposure to violence and the inability for community members actually to respond and prevent gun violence. The second question we're interested in asking is whether increasing social cohesion and collective efficacy may lead to a decrease in exposure to gun violence, again, in high-violence areas in New Haven. We hypothesized that building community resilience through these levers of social cohesion and collective efficacy would mitigate gun violence. And kind of a secondary hypothesis that we were really exploring is whether or not we could actually do it. These are neighborhoods that are disenfranchised, where neighbors no longer knew neighbors, where they had significant mistrust in government institutions, certainly university researchers, and we really wanted to see if we can even successfully build and sustain a coalition that would create capacity in these neighborhoods to build resilience. So here is a slide of our study design, and in our pre-intervention phase, we conducted a survey to assess social cohesion and collective efficacy and to examine the association with our primary dependent variable of gun violence. We conducted the survey this past summer, and those are the results that I'll share with you today. We're currently, again, in the building community resilience phase. And then we'll go back again next summer and then assess the same kind of constructs, the social cohesion, collective efficacy, and exposure to gun violence. And again, these are pilot data in two neighborhoods. So the methods that we use then are the ones that Orion introduced, which is community-based participatory research. Again, this is a collaborative, rigorous, community-focused approach where community members and researchers have contributed equally and in all phases of the research, recognizing each other's expertise. And just to highlight that, this question, the actual framing of our question came from community members entirely. So, you know, when I first started joining the violence prevention group, I was very much focused on more downstream issues of incarceration and how to improve reentry efforts and the capacity of reentry organizations in New Haven to respond to the needs of families and individuals that are returning home from prison. And in fact, the group wasn't at all interested in that. They were really interested in thinking about people that were outside the criminal justice systems, people outside of the victims and their families, certainly people outside of the perpetrators and their families, but really thinking about what the impact of chronic exposure to gun violence is on community members. Together we developed a 55-item survey, and this included, again, so this is where researchers can kind of bring a little bit of the rigor to the process. I used validated measures, so we chose the Sampson Collective Efficacy Scale, which is a well-validated measure of social cohesion and collective efficacy. We chose the exposure to violence scale, which has been used in the most robust study of gun violence, at least in the United States, in Chicago, the Project on Human Development, and then included some key focus questions, community design questions that were going to be the questions that would start the basis for developing our intervention. So questions that community members were really interested in their next steps of building resilience. As for our methods, we trained 17 community members, and we used curriculum that's been developed. It's housed out of UCLA, available free online, the Data and Democracy curriculum that trains community researchers in research ethics, survey design, survey administration, and data analysis. So we trained 17 community members in a 3-day-long training that has been an iterative process, as Orion described, in survey administration and design. This not only honored CBPR principles, but also has built capacity in these communities of even understanding the kind of fundamental tensions in research, why it's important, what are issues of ethics, and why do it at all. We designed a sampling frame in 2 out of the 6 kind of high-violent crime neighborhoods in New Haven, and we intentionally chose neighborhoods, the first of which, so Newhallville is probably the most disenfranchised neighborhood in New Haven, and West River is probably the most kind of organized neighborhood, just trying to simultaneously build capacity between these 2 neighborhoods. So the individuals, the leaders of West River, could somewhat mentor the individuals in Newhallville. We sampled in areas in these 2 neighborhoods where there were high exposure to violence and where community members hypothesized there would be low social cohesion. And then we used random walk methodology and surveyed between May to August of 2014. So in our pre-intervention phase, and these are the data that I'll present today, we collected descriptive data about the neighborhoods and then did some kind of bare bones linear regressions comparing social cohesion and our primary dependent variable of interest, exposure to violence, as well as collective efficacy and exposure to violence. And I will just say here, and then our post-intervention phase, we're using a difference and indifference analysis. These are measures that, while they're administered door-to-door to individuals, these are measures that are intended to reflect actually neighborhood rates of social cohesion as well as exposure to violence. And so these are analyses that are done at the neighborhood level. So here are results. This summer, I'm really pleased to say it, our community surveyors visited 300 homes with 153 surveys completed. And in doing that, it's split half and half between the two different neighborhoods. The refusal rate was only 14%, and we have in New Haven a much larger neighborhood-based survey where the refusal rates typically are on the order of 30 to 40%. And so this, I think, speaks to the fact that these are actual neighbors that are going to neighbors' doorsteps and administering the surveys. I do show here that there were 35% of homes where we did try 3 times and no one answered. When we did survey, we tried weekends, nights, mornings, different individuals, and these are kind of standard, ways of tackling kind of these issues of non-response, essentially. So this is on the higher side. In these neighborhoods, there are a significant number of abandoned homes, and so when we've tracked at least in one of the neighborhood, 80% of those 3 attempts, we believe, are due to abandoned homes. But that said, it is a 35% non-response rate. In looking at the age of respondents, what you'll see is that the majority, so more than 80% of respondents, were between the ages of 25 and to 64. About 50% were women. You can see that the average number of years living in the neighborhood was 16 years. So these are people that have lived in the neighborhoods for a significant amount of time. There are young people living in these homes, so 56% of the addresses had a minor living in the home, and then again, about 60% had a senior citizen living in the home as well. And the majority of individuals, and it should be no surprise, but the majority of the individuals do not own their homes, they actually rent their homes. And so these results speak to the basic question of how many neighbors do you know. And so in looking at these 2 neighborhoods, again, there's New Hallville and West River, 42% of the individuals that were surveyed in New Hallville reported knowing either none of their neighbors or a few of their neighbors, and 57% in West River. And these are significantly higher in, again, more cohesive and well-enfranchised neighborhoods. In turning to our first measure of looking at our independent variable of social cohesion, these are the 4 items within the collective efficacy scale that assess social cohesion. And so I wanted to turn your attention to the kind of these 2 top, the top and the bottom row here. This is assessed on a 5-point Likert scale. And in looking at that, 25% of respondents strongly agree that people in this neighborhood can be trusted. This can be contrasted then to 60% strongly agree that people around here are willing to help their neighbors. And so like other studies, again in neighborhoods much like New Hallville and West River, the concept of social cohesion is incredibly complicated. That on one end, there's issues of trust and mistrust of their neighbors, but at the same time, people are willing to still state that they're willing to help their neighborhood. And these are results that have been shown in other neighborhoods in New Haven, as well as other larger national studies looking at social cohesion in neighborhoods equally disenfranchised. In turning to then several items within the full collective efficacy scale, again, I just present some of the items here, and I just highlight the ones at the bottom. These are the ones that were the most salient to our community members. About 50% of respondents said that they were very likely or likely, that they thought that it was very likely or likely that their neighbors would intervene if there was a fight in front of their house, and 60% said that they thought their neighbors would intervene if there was a local fire station that was closing due to budget cuts. Here's our primary dependent variable, exposure to violence. These are incredibly troubling data. 95% of our respondents have heard a gunshot. If looking at this, 67% of respondents reported that a family member or their friend had been hurt by a violent crime. 60% of them reported that a family member or friend had been killed by a violent act. And then 33% had actually seen or been present when someone was shot. And then finally looking at kind of the associations between our primary independent variables that we're interested in, dependent variables, we did find that social cohesion and collective efficacy are inversely associated with exposure to violence, as our community members had hypothesized. In turning to some of the community questions, so this just gives you a sense of the questions that our community members were really interested in. They were interested in whether their neighbors had had conversations with their children about having guns in the home. They were interested, one thing that would never have occurred to me, but it was really common, is given the rates of gun violence in the community, many of them had had experiences where neighbors didn't have enough to bury their children and family members. And so a key cause of concern for them was how many individuals in their communities actually had burial insurance for themselves or for their children. This is something as a researcher I would never think to ask. This isn't something that is in my daily, and this is something that many families didn't have $10,000 to bury their family members, our community members were saying that if only our neighbors knew that you can buy burial insurance for $3 a month, this would be worth it. And so this is a sampling of the sorts of questions we added. Have you had a conversation with your children about guns? 67% said that they had. If a violent act occurred in your neighborhood, what would you do? It was actually quite high. Many people were saying that they would never call the police. They didn't think individuals would call the police, and 75% were saying that they would still call the police. In turning to this issue of burial insurance, about 50% of the adult family members did have burial insurance, and disturbingly, 30% have burial insurance for their child family members. We asked kind of 3 open-ended questions, again, about what things that you'd like to see happen over the next year to make your neighborhood a better place to live. And the 3 most salient themes that emerged, first was one of community, that they wanted more get-togethers and community events. They wanted empty homes to be fixed up. Again, like I said, there were many abandoned homes in these neighborhoods. And they wanted to see a beautification of their streets and yards. The second most prominent theme was around youth. Not surprisingly, they wanted to see recreational centers, school and weekend programs, summer camps, parenting classes. And then third, I think quite interestingly, again, New Haven is I wouldn't call it a city, but a very urban town where there is lots of mistrust of the police, and yet they wanted more police presence. But they wanted police presence in a very specific way. They wanted them out of their cars. They wanted them to stop profiling. They wanted them patrolling, walking, biking, building relationships. They wanted to be able to say, hey, Officer Leo, and have his cell phone and know that this was a human-to-human relationship that they had with another human being that was there to help protect. So some limitations, again, I showed the age distribution of respondents. We really missed kind of 18 to 25-year-old individuals. And again, those are the individuals in New Haven and certainly around the United States and in Puerto Rico that are most involved in gun violence. And so this is an important limitation of our work. The second was that we had English-speaking surveyors only, and so we only got English-speaking respondents. These two new neighborhoods, New Haven has one neighborhood that has a very high percentage of Spanish speakers, and so this wasn't one of the neighborhoods, but this is a limitation of our results. As a pilot study, we did it in two neighborhoods. We intentionally picked these neighborhoods. It's where we had kind of the strongest neighborhood interest in the work that we were doing, but our results are certainly limited to these two neighborhoods, and even we intentionally sampled areas that had high exposure to violence. And then, you know, it's a cross-sectional study, so we can't determine directionality or causation in any way. But some of the conclusions I would say is that first, that community-based participatory research approach in this area has been valuable for identifying, I think, unique and novel solutions to mitigating gun violence, or a potentially novel solution, I should say, to mitigating gun violence in the sequelae. Again, there have been no community-led efforts in New Haven, and many, when I say many, I mean New Haven has been the recipient of many federal grants, many Department of Justice grants, all trying to mitigate gun violence, and the rates have climbed. And so the important thing is that without kind of equitable, true, meaningful engagement of community members, the repercussions of gun violence I don't think will ever be mitigated. The second is that we did find that social cohesion and collective efficacy are associated with reduced exposure to violence, confirming the first hypothesis, again, of our community researchers. And thirdly, a multi-sector approach, especially including community members and their key stakeholders, is needed to address and prevent gun violence. So as far as next steps then, in this process of having conducted research, the Community Resilience Steering Committees have now supported the creation of two community resilience teams in these two neighborhoods. The resilience teams are grassroots efforts, volunteer community members who are engaged in building social cohesion in their own neighborhoods. And their interventions have so far started where they've identified and developed local leadership. They designed and distributed these community resilience handbooks and toolkits, and so this is a 30-page kind of really neighborhood-focused toolkit that includes, you know, almost a checklist for how you respond. So if a member of your family is on the ground having been shot, what do you do? So really, really, literally, firsthand, how do you respond to how might you prevent it? Do you know where your child walks when they come home from school? Do you have a kind of a buddy plan? Have you created a phone tree? Do you know what are the mental health crisis lines in New Haven that are available post a gunshot for you, your family members? You know, even if you haven't actually been the recipient of a gunshot. Where do you get burial insurance? Those sorts of things. They're meeting biweekly. They're building personal relationships by, you know, door knocking each weekend, organizing community events, connecting with local organizations. They communicate with city leadership, and they collaborate with a currently NIMHD-funded CBPR project also that focuses on preventing and responding to gun violence among youth in New Haven. And so I think that this speaks to kind of what Urian was talking about, which is this overlap between action and research, that they aren't in conflict. They're constantly an iterative process that kind of reifies the other. Our next steps are, you know, these are two of our members of our resilience teams literally going door to door with their bags. They are also sitting at the table with the head of police, our mayor, the head of youth services, talking about building resilience. And again, this is a moment in New Haven where instead of focusing solely on these negative operators, solely on the kind of the negativity around designing interventions that focus on the criminal element or the victims or the perpetrators, they're talking about how we use the assets that we have here in the community to actually strengthen and leverage, mitigate, and prevent prevent gun violence by, and this is the title of our project, putting neighbor back in hood. Our next steps, and this is an example of capacity building, we were invited, and when I say we, I almost never give this talk. Our community members actually are giving this talk. We're invited at the Institute of Medicine to present recently in the Means of Violence Conference, and so this is an example of how capacity can be built. Many of these individuals never even heard of the Institute of Medicine, wouldn't even known what it was, and we're invited to present there as well as at the Robert Wood Johnson National Conference. And so this talk looked very different when they were giving it than I. They did a much better job. But again, this is an example of how capacity can be built through research using a CBPR method. And so I just wanted to acknowledge all the members of our steering committee. Again, it's a really diverse group, and then the survey team that really pounded the pavement this summer in New Haven, which actually wasn't that hot of a summer, but it's still not hard. Our funding for this comes from the Robert Wood Johnson Foundation, as well as supported by the Dean of the School of Medicine. And then with that, I'll stop and then leave time for Leo. Thank you so much for your attention.